Hi, how are you? This is Damaris Maria Grossman, and this is the Mindfully Integrative Show. And today we have an amazing mindful chat with Dr. Sameerh Suhail. He is a doctor, he is an entrepreneur, health investor, philanthropist, and he has started a company called Foresight Health. And he can talk to you a little bit more about that and how he has impacted the healthcare field and how he is doing. So, how are you today,
I
Dr.
am doing
Suhail?
well. I am doing well. Thank you very much.
Oh, I'm so glad that you could be on. And as I kind of start the show, what's a little fun fact that people don't know about you?
Well, a, a little fun fact is, I love boating, so I love going out on the lake a lot.
Hmm.
So I enjoyed the waters. Um, but my passion is healthcare, and I've always been in healthcare since I've graduated as a medical doctor.
Hmm.
And one of my passions is basically serving underserved areas. And when I started my healthcare career doing my clinical rotations, I spent most of my time doing them in areas that are underserved, hospitals that are in very rough areas. And I'd seen healthcare, from a view of a very low end of services that were offered to the community. And I've, throughout my career and throughout the years I was doing my clinical rotations, I decided I think there should be a better way to service, and there should be a uh, more innovative way to actually bring healthcare to areas that are underserved. Unfortunately, our system doesn't help because healthcare has transitioned into a business type of
Mm.
entity. It's no longer about compassion, about treatment, about individuals. It's changed. The dynamics of healthcare throughout the years have changed. So um, I continue to serve and open entities that serve areas in hospitals. One of my primary, you know, business entities that I opened was to actually help a lot of medical students get placed into clinical rotations and help them get into residency programs and create more physicians in the workforce and bring in more doctors
Hmm.
because I mean that's a whole different subject. We can go into a subject that talks about the shortages of physicians and the
Mm.
shortages of individuals that wanna actually go into the healthcare field. A lot of people don't understand the dynamics of it. So that was my primary, business initially, and I helped a lot of physicians uh, get into their careers. A lot of our students are
Oh,
now
that's great.
attending subspecial attendings, and have gotten into hospitals, and they're serving communities that are underserved, and I'm very proud of it.
It's so
So
important. That's
yeah,
so important because
absolutely.
I worked in a mobile health clinic as a family nurse practitioner, and the amount of need in different cities, it's just not even just cities in different parts of the country and the world are so needed.
And you know the demand is very high, especially in communities that are rural or underserved. And unfortunately, the problem is it's becoming a little bit unattractive for the younger generation to go into these fields because the compensation, the benefits, the work time that they have to put in, the length of time they have to go to school
Oh,
to,
it's
you know. So it's becoming unattractive for a lot of the younger individuals, unfortunately.
I
You know,
think that I mean hopefully you're making a change and in the nursing field I'm making a change to to see that show people that there's we can still make a difference. I mean I talk a lot about just in the telehealth space if we can just bring more access even a lot in that underserved area. Hoping that that'll help. And I know that your company, you have a large company that you've also done too a lot of work with.
absolutely. I've created several service lines. Like I'll give you a great example. During COVID, there was you couldn't even find PPE equipment.
Mm.
You know, price gouging was taking place. And there was a lot of individuals that were basically taking advantage of the situation. I've acquired and I've helped hospitals, clinics. I've helped other people. I've Back in 2013, I purchased a hospital that had a lot of that stuff. So
Mm,
I helped the hospitals procure a lot of this stuff during 2020, and it's just very unfortunate that a lot of people take advantage of a situation like that, and just come in there and realize that this is a long-term effect, not a short-term effect. you know Healthcare is a necessity of life. It's like food. You have to eat to survive. Everybody's eventually going to get sick, so there's going to be there has to be resourceful products. You have to be resourceful nurses. There have to be resourceful providers.
yeah.
Like, one of the fields I've gotten into the past 4 or 5 years is psychiatry, for example. I'll give you a great example. Psychiatric services are very depressed, not only in the US, but around the world. So I've realized that, and even after COVID, I wasn't psychiatric. I run a psychiatric physician group before COVID, but after COVID, you have child psychiatrists you couldn't even find. You have, adolescent geriatric psychiatrists that you couldn't even find. So we try to veer into telepsych, and we try to, help as much as we could, to make it useful, because people were getting depressed, and
Mm,
it was an obvious truth. Suicidal rates went up. You have issues, drug addiction, substance abuse. A lot of doctors retired. Don't forget, a lot of doctors, older physicians that were practicing for 30 and 40 years were in the field, and
exhausted.
yeah, and at the end of the day, they didn't want to risk their lives, and they said,
Mm-mm.
you know what, forget it. I've been in the practice for 30 years. Let me just basically just step down, and I'm not going to risk my life after 30 years getting exposed, to a virus that's going to kill me within, a few days. So what happens there? You have a shortage on one end. You don't have newcomers that are coming on one end, and now you have to deal with the dynamics of how do you balance, and what happens to the people that you're already dealing with, the providers that are providing services. We need to attract more people into the healthcare field. We need to make it a little bit more easier. We need to make it a little bit more attractive. And again, it's not only about finances or about the reimbursements or about that. I think in general, we depended on healthcare the way it ran 40, 50 years ago, and we kept on the same track. We didn't dynamically change it, and I think you need more fruitful minds to come in and say, let's give an opportunity. Let's not put all the burden on physicians. Let's create. For example, there was a program I got into that back in, I think that was, if I can remember, that was back in 2015, 2016, clinical pharmacologists. And, they were, many states have acquired that. They wanted clinical psychologists to start prescribing and start seeing patients. That lifts a little bit of a burden off
Mhm.
of the psychiatric, arena. And, and unfortunately, it didn't go long. So it's just, there's a lot of rules and restrictions in the healthcare field. There's a lot of scrutiny. So I think they have to ease off a little bit on, how the healthcare arena runs. Because at the end of the day, like I go back and I say, it's a necessity of life. So it's like food. It's like you sleep, you eat. Everybody eventually will get sick. Everybody's going to need medication. Everybody's going to need treatment. Everybody's going to live and die. So we need to basically understand that we're going to live with healthcare no matter how our lives change. So I try to change a lot of my business dynamics, make it a little bit more attractive for younger generations to come in and acquire. I look at areas that are underserved. Foresight Health, we've created this year. I've been blessed, and I've gotten an opportunity to help a community out of Stewart, Virginia. That's going to come in basically, and Foresight is going to come in and give healthcare back to that community. And on
That's
top of
amazing.
that, I'm going to add psychiatric services, and the community, the leaders of that community are very excited. We're very excited. Everybody's very helpful. The last meeting we've had with the EMTs, EMSs, and the sheriffs, the police, everybody, all the leadership in that community are very excited that Foresight is coming to help and reignite that hospital. Imagine you have a community that's Patrick County, Southwest, Southeast Virginia, population, I would assume maybe about over 30,000, and they don't have any ED, they don't have any emergency services,
Mm,
they don't have any beds. What happens if somebody gets sick? They would have to fly them out with a helicopter. It takes about 15-20 minutes for paramedics to get there. By the time they get to the hospital, it's very unfortunate. You know, when a person gets sick, specifically if it's a trauma level sickness, time is of the essence. And,
mm,
and I've learned that, you know, in my clinicals and practicing, every moment counts, especially if a person has a stroke or if he has heart issues or any other type of disease. So it's very unfortunate that, we've had over, I would assume, over 150 hospitals, rural hospitals that closed in rural areas. This shows you that that we're not focusing on the right track. That we as people live for communities. We have, I mean, when you create communities, you're creating infrastructure in these communities. If you don't have healthcare part of your infrastructure, that's weak at the end of the
yeah.
day. So you're not fulfilling the infrastructure that should be there. So it's very unfortunate. Obviously there's restaurants, there's people, there's department stores. You create all types of jobs, but you don't have a hospital, you don't have a clinic, you don't have an urgent care center, you don't have an emergency room center. What good is it for to create a community that people have to travel 1 hour to go to a hospital? So it's
Mm,
very unfortunate. So I was blessed and I got the opportunity to take over a hospital that was shuttered and closed.
mm.
And we're definitely on track opening it by January 31st. And I
Oh, this
really,
coming year?
January 31st of 2023, correct? And I really want to serve that community. And
Where
one
is
of
it
the other,
located?
it's located in Stewart, Virginia.
Stewart, Virginia. Okay.
Virginia, which is a rural area. And what's beautiful, it's a beautiful county, it's a beautiful town, and Virginia itself is amazing. It's beautiful. But the people of Stewart, Virginia, are very amazingly wonderful people. They're they're very welcoming and supportive, and it was very unfortunate that this took place about 5 years ago. And I'd like to definitely go in there and help them. And one of the great things that I'd like to do also as well is, and I said this before, was create an advisory committee. And the advisory committee for the hospital is to basically see what the community needs are. And I've learned throughout my years that it's not only about, even though I'm a for-profit, it's not only about the money or about the entrepreneurship of making a good business or creating a good service line. It's really about giving back to the community. So
Mhm.
one of my ideas of coming up with this is creating an advisory committee. If there are service lines that benefit the hospital or Foresight, but it doesn't benefit the community, I don't want it. I want something that's going to come in there that's going to benefit the community. And I want the community's input, and the advisory committee will be there to make sure that what the community needs is what we're going to put in place, basically. So this is a lot of things you learn throughout your years, in the healthcare arena, and
Mhm.
and you start correcting, and it kind of dynamically changes how your thought is. And
Yeah.
Yeah,
I mean, you're obviously changed from just being so medical doctor in the clinic for yourself and just trying to your view of where you want to integrate and change. You know, you want to make the underserved have a better outcome in their life because when they have a healthier outcome, then they do more, then they excel
absolutely.
more, then they educate more, then they're mentoring people. So it's, it's a ripple effect and it's, little by little. I mean, that's just another, aspect of this. And then you're helping, like you said, your colleagues and students that to become doctors and those young and, young ones and individuals. I think access to health is one of the most like it should just be a normal everyday thing, right? But
Absolutely. And you pointed out something very good. It's Dr. Damaris, right?
I'm a doctor of nurse practice. I'm a family nurse practitioner. Yeah.
Well, I'm still gonna call you Dr. Damaris. So
You can call
so
me
so
Damaris.
you pointed out a good you pointed out a very good point, and it's all about educating individuals, preventive medicine.
Absolutely.
If we stay on the track of just treating these patients, and I've seen this firsthand when I was doing my clinicals. I've worked with physicians, I've trained under physicians where patients would come in. It's just like counting numbers. They would come in, fill the prescription, next, fill the prescription, next, refill the prescription, next. This is not the type of medicine that should be running in the century we're in right now. What we should do is sit with the patient. We should educate the patient how to manage their diseases, how to manage their symptoms, and again, and this is the type of medicine that I'm looking forward for. And this is what the younger generation should understand, that it's not seeing the patient and increasing their dosage or decreasing their dosage or not educating them. It's about, what? This is your disease. You have to live with it for the rest of your life. You're going to have to manage your dietary. You're going to have to bring in a dietary, a dietitian. You're going to have to bring in a nutritionist. You're going to have, it's a dynamic of group of healthcare providers that have to work in groups together to make sure that one person's health is effectively good, and that the person himself understands that, not only the providers. Because at the end of the day, and this is where I come from, the fact that I say we have to make this very cost effective. You know, we we're charging, you walk into an ER, they charge you $50 for a Tylenol pill. Why are we, I mean, at the end of the day, I'm a very honest and transparent person. You know,
Mm-hmm.
you know, you're not going to have a good healthcare system if it's not cost effective too as well. So there's a lot of things, and I mean, I'm probably one voice that's not going to change, but at the end of the day, I like a lot of people to understand that, what, this is something that's going to not only affect us right now, and we might not live to see the changes, but it's going to affect generations that are going to come after us, and it will help generations that are coming after us. So one voice might actually resonate in other people that actually say, yeah, we should have a change in healthcare, you know,
Yeah.
and it'll help our children, it'll help our grandchildren, our grandchildren. This is something that's going to go a long way. So I hope you know where I'm coming from and understand
No,
how
I
the
do.
process.
I absolutely think that the access of care is so important in getting these individuals health care. I'm a big, big advocate for telehealth in a as an adjunct to
Sure.
medicine because I have met way too many of situations where I have needed to have an individual have access to care. And my next pillar with that is bringing the diagnostic tools to those individuals. So I feel like that's another area in addition.
Absolutely,
Yeah,
absolutely.
so I totally agree with you. Couldn't agree more. How can those individuals reach out to you and get to know you? How are what's a website that they can reach you or how they can get to know you?
So foresight 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 health.us is our website.
Okay.
And we currently started accepting applications about weeks ago, a few weeks, I can't remember, less than a month ago, through the Virginia hospital. But individuals can also always reach out to me. I mean, I'm on LinkedIn. I'm not very active on LinkedIn, to be very honest with you. I do run other service lines, but
Mhm.
if anybody wants to reach out to me, I mean, it's I, I'm on the internet. I can be Googled,
Of
and
course.
they can reach out to me through my group, Foresight Health.us. They can
Perfect.
send, emails if they want, any help, if they feel like, you know, that what I'm saying is something that they would like to, make bigger healthcare providers, students. I've always been, very supportive, to anybody younger generation where they wanted to go into the healthcare. I've always supported them to do that, and yeah, so they can reach out through emails and through the website. There's some information on the website. They can put in, that we'd like to talk more. We'd like to, come in, see what Foresight is. We're based out of Chicago. We're expanding to Virginia, like I said, and the hospital will hopefully will be open by January, and it'll be something very good. Maybe we'll meet in person one time, and we'll discuss
Con-
more.
yeah,
And
congrats on this. Very exciting.
absolutely, absolutely.
Well, I appreciate you being on the show. Is there one last thought you'd like to leave the audience?
The a last thought. There's many last thoughts, but the best one I can think of is basically so far is, we have to be compassionate with each other, and we're in a time right now where you see, and COVID has changed the minds of everybody, and it's and just we just have to be compassionate. We have to be uh, you know very forgiving. We have to be, because healthcare is about also emotions. It's about, and I always say that mental health, if you if you're more about, controlling your mental state, the rest of your body will also heal. So at the end of the day, any sick person, if you give them positive feedback, they're gonna emotionally feel much better. So I would say, us as humans, we're all, we're all the same. Nobody's better than the other, and we have to be compassionate, helpful, with each other, and keep and just keep on seeing if we can do any changes in that arena, and hopefully there will be changes, and it'll come soon. But it might start with one person, but eventually there will be changes,
It'll be changes little by little, little by
little
little.
by little. Exactly.
Well, thank you so much for being on the show. I really appreciate your time.
You're welcome. Thank you very much, Nat.
I appreciate it. And you have a wonderful day. And thank
You
you
too.
guys for coming on to the Mindfully Integrative Show. And make sure you find a mindful way every day.